Assalamu alaikum wa rahmatullahi wa barakatuh. A very good morning to all of you. We have finished with self-examination of the breast and various methods of examination of the breast. If you notice a lump in the breast just before periods, or if you notice heaviness of breast, tenderness of breast, fullness of breast, please do not panic. All this happens because of the changes in the menstrual cycle, the hormonal changes in the menstrual cycle. In the first half of the menstrual cycle, a hormone called estrogen is released. This estrogen helps in the development of the egg. In the middle of the cycle, the ovulation occurs. Ovulation is a time when the egg is released and the lady is capable of getting pregnant. Soon after ovulation, the hormone called progesterone is released, which helps to make the bed of the uterus ready to receive the baby, and also the changes occur in the breast to get the breast ready in preparation for the milk production. If you don't conceive, then you notice your periods begin. Soon after your period starts, you notice that the lump which you felt just before periods disappears or becomes smaller in size. The tenderness, the pain, the heaviness, the fullness all disappears. That is why we ask you to examine yourself usually after the 6th or the 7th day of periods. In menopausal women, it's better to keep a day in the beginning of the month or the end of the month so that you will never forget to examine yourself. During your examination, if you notice any redness, any change in the skin coloration, any dimpling or wrinkling, or the skin texture is changed, something like orange peel, or if you notice retraction of the nipple or any blood stain discharge or anything dribbling from your nipple, please do not ignore. Go to your doctor immediately. Never forget to palpate your armpits for any lumps. It's very important because early detection is the best to prevent us from the later stages of cancer. So if you notice any of these changes or a lump, report to your doctor. As soon as you go to the doctor, she will examine you, she will feel you, she will palpate your breast and your armpits. After taking a detailed history, then she will write a bank of blood tests, and also she will ask you to go for an ultrasound which can pick up the lump, and a mammogram also. If they notice a lump in the ultrasound and mammogram, then they ask you to go in for a test called fine needle aspiration cytology, wherein under the guidance of the ultrasound, they pass a needle over the lump and they withdraw a little material, and that is sent to the lab, where it will be confirmed whether it is benign, that means it is not cancer, or malignant, which means it is a cancerous lump. So these are the usual tests which are advised to you. What are the other types of lumps which one can notice? One could be because of abscess formation due to infection caused by an infected pustule, or a scratch mark which gets infected, or a love bite which gets infected. It can form because of infection, it can collect pus beneath it, and an abscess. This is called an abscess. Or you can also notice lumps which I explained to you before periods, which are called fibroadenoma and fibrocystic disease of the breast. This is not malignant. This is very benign. Benign means it is not cancerous. So please do not worry. Any lumps should be reported to your doctor. If you notice any discharge, also please don't neglect.